So today we're going to be covering the meninges. مع meninges we're covering the dural venous sinuses. بعد ذاك ventricles and CSF, it depends. We might go through it, we might not, depending on whether you guys did it or not. So when you guys see it, just tell me if you remember إنه دخل معاكم ولا لا. And then lastly we're going to be going through cerebellum. تمام؟ ممكن ال ventricles وال CSF نمر فيه سريع just in case. Okay? So first of all, when it comes to meninges, there are 3 layers of meninges. عندنا الدورا mater, والarachnoid mater, والpia mater. تمام? So there are 3 layers that are surrounding the brain and the spinal cord, or the CNS in general. هو الدورا mater, arachnoid mater, وpia mater. يعني برا آخر واحدة هي الدورا mater, so externally. Then في arachnoid mater in the middle. Then في pia mater, which is internally right around the brain. Okay? So the basically in general. They surround the CNS. So the brain, the spinal cord, the cerebellum, midbrain, brainstem, كلهم. So like a dura mater is the one that's outermost, so it's like nearest to the skull, while the pia mater is the innermost, so it's nearest to the brain, while the arachnoid mater is in the middle. تمام? So we'll be talking about each one of them and what's most important in each one. يلا dura mater has 2 layers. Right? فيه endosteal layer or meningeal layer. Always when I'm talking about dura mater, I usually try to tell people to imagine it, that it looks just like a peritoneum or like the pleura or something like that. تمام؟ يعني هيكون فيها 2 layers, layer برا و layer اللي جوا. اللير اللي برا بنسميها endosteal layer, so it's the one that's right below the skull. Then في another layer which is called the meningeal layer. تمام؟ يعني endosteal layer دي it's just on the outer, while the meningeal layer is closer to the inner side, and the meningeal layer forms a lot of folds. So it's foldy. It'll fold in specific areas. What these folds they have names. تمام؟ يعني we have 2 layers of the dura mater. Endosteal layer, which is the layer that's just inside the skull. That's it. وفي meningeal layer, which will form other folds and structures. So most of the time when people are talking about dura, they're talking about the meningeal layer. تمام؟ يعني similar to when we would say visceral pleura or parietal pleura. Same idea. So ده اللي بيكون برا البارايتال وده اللي بيكون لجوا الفيزورال. Make sense? Okay, تمام, perfect. Then عندنا layers, folds اللي بتصنعها, the folds that are formed. We have 4 of them. We have one that's called falx cerebri, one that's called falx cerebelli, one that's called tentorium cerebelli, and one that's called diaphragmacellae. Okay, so I know their names are a bit confusing في البداية, لكن when we start explaining them, you'll get them. Right. Cerebri, falx cerebri, is a layer that's going to be between the 2 cerebral hemispheres. Okay, so it's between a cerebrum. Okay, so that's why it's called cerebri. And falx is like in middle, so in the between. So it's between the cerebrum, while falx cerebelli is between a cerebellum. So if you look at the cerebrum, there's 2 cerebral hemispheres, right and left. Between them, you'll find a falx cerebri. Well, if you were looking at the cerebellum, between the cerebellum hemispheres, you'll find the falx cerebelli. But actually, I'm going to show you a picture, so don't worry too much if you can't imagine it. لكن بس أعرف إنه when the naming of the cerebri or cerebelli is very important to tell if it's the cerebrum, the brain, or the cerebellum. تمام؟ في تاني tentorium cerebelli, which is on the top of, this one is between a cerebrum and cerebellum. Between cerebrum and cerebellum. So like in the posterior aspect of the brain, عندنا cerebrum, so the brain, and تحته في cerebellum هنا, صح؟ يلا tentorium cerebelli, it's here. it's here. So it's found between the cerebrum and cerebellum, or on the top of the cerebellum. تمام? So it's on the superior surface of the cerebellum or between the cerebellum and the cerebrum. آخر واحدة اللي هي diaphragma cell دي, it's found in the pituitary in the pituitary fossa. تمام? So الpituitary fossa, if you know, its name is the sella turcica, right? So a diaphragma cell دي قاعدة في sella turcica. That's why it's called cell. Okay? سامعيني يا جماعة كلكم؟ Okay, great. So يلا دي basically the 4 folds of the meningeal layer of the dura mater. تمام؟ يلا I'm gonna show you a picture. Okay. دول ما show you a picture. There's just this small fact. إنه الدورة is innervated by the trigeminal nerve and it's sensitive to stretch. So that's why it causes headaches. So headaches are basically an irritation of the dura mater. And if you feel a headache, it's not your brain, it's your dura mater that's irritated. What trigeminal nerve is the one that's supplying it, so it's sensitive. You can feel it. Right. Here in this diagram, the only thing I'm trying to show you is if this is the half of the brain, so the half of your brain or half of your brain, هنا would be the location of falx cerebri. So falx cerebri would go here because it's between the two brains, or brain hemispheres, while falx cerebelli would go here. And then the last one اللي هي اسمها tentorium cerebelli is this one. This is tentorium cerebelli, so it's between the cerebrum or cerebellum. الdiaphragma cell ما ظاهرة هنا. They'll only be obvious when you are actually looking into the pituitary fossa. تمام؟ يعني عندنا falx cerebri والfalx cerebelli والtentorium cerebelli. تمام؟ تمام. Great. So this is basically الfolds حقت الدورة. Here again another picture of them. إنه الfolds بتكون المش ده, it's basically the folds. إنه ده tentorium, falx cerebri would look like. تمام؟ or falx cerebri here. Any questions? اوكي يلا بعد ذاك عندنا spaces. الدورة ذاتها فيها spaces. في epidural space وفي subdural space. تمام؟ يعني في space above the dura وفي space below the dura اللي هي epidural space و subdural space. تمام؟ يلا السبيسز ديل what's important about them is الهemorrhage أو الهيماتوما اللي هم الepidural hematoma والsubdural hematoma. Very important to know the difference between them, to know which one is found where وكده. تمام؟ So basically, let's see if I do have the differences. تمام؟ So an epidural hematoma is arterial in supply. It's damage of the middle meningeal artery. تمام؟ دي أول حاجة عنا. So epidural is arterial و middle meningeal artery, while a subdural is venous, which is due to a superior cerebral vein. تمام؟ but بما إنه دي artery ودي vein, you'd assume that this happens way quicker. تمام؟ So يعني epidural happens really quickly, and it's usually in younger patients after trauma, right? So injury to the skull, fracture of the skull, and so on, because a middle meningeal artery got the ficterian, right? So it's the most weakest point of the skull, and if you were injuring the skull, the middle meningeal has a low damage, هيبقى في arterial blood, epidural hematoma. تمام؟ لكن السبدورال hematoma is due to venous. So the veins are less pressure than فيهم less pressure than the artery. So it takes time. تمام. And it's usually in old people. تمام. يعني really old people with time they would have a venous blood collect and it would cause a subdural hematoma. تمام. وقعت لكم الحاجة دي so far. تمام. تاني عندنا what it looks like on a CT scan. So دي حاجة مهمة شديد إنه what does it look like on a CT scan. So when you look at a CT scan, you're supposed to be able to tell if it's an epidural or a subdural. An epidural looks like a lens, while a subdural looks like a crescent. And I'll show you guys a picture here. Like in this picture, D it looks like a lens, so it's كده. D an epidural hematoma, while a subdural looks like a crescent كده. عندي. تمام. يعني usually if you look at it, if it looks like a crescent shape, أو eye convex eye. So the convex, the concave. Yeah, you could say that. So the convex, the concave. أو the lens shaped with the crescent shaped. تمام. So you gotta know, tell the difference between the shape حقهم, which one is which. تمام. This is probably like the easiest marks in the entire meninges كله. Like make sure you know this very well because it's gonna be in the exam. تمام. The symptoms are sudden, are like loss of memory, headaches, حاجات زي دي. لكن يعني they don't usually ask you about the symptoms كده. لكن these are usually the symptoms. Signs of increased intracranial pressure, which are signs of increased intracranial pressure are basically headaches, vomiting, projectile vomiting, blurry vision. These are some of the signs that they could show up with. Oh, convulsions. Thank you. I forgot that one. Convulsions. So signs of increased signs of increased cranial pressure وبيجوا برضه memory loss sometimes أو confusion. يلا الميموري loss والconfusion دي أكتر حاجة بتجيهم لناس الابيدورال للسبدورال sorry. So subdural, since it's not bleeding a lot or that fast, they could show up with these symptoms first before their intracranial pressure actually gets that high. So مرات they'd be like old man with memory loss and confusion, and they'd mention like one of these with a headache, no history of trauma, nothing like that, and they'd ask you what type of hematoma would he have. So most likely if يكون subdural. لكن يقول لك young patient got into a motorcycle injury or something, and then he started having headaches and vomiting, it's probably an arterial, so it's epidural. Usually they give it away بإنه بيجيبوا لك سيرة الشيب of it. يعني بيقول لك إنه it's crescent shaped or lens shaped or like concave or convex on the CT scan. تمام. يعني most of the time the questions حقتهم are not difficult at all. طيب كده احنا we basically covered the spaces اللي هي epidural space و subdural space, and we covered the folds ذات نفسها. يلا في حاجة تانية أخيرة، حاجة اسمها dural venous sinuses. طيب يلا dural venous sinuses ديل they are basically veins and like areas of venous blood. تمام. يعني هم يعتبروا veins أو venous drainage of the brain. Okay. And هم basically it's this whole connection of sinuses مع veins في النهاية بيدونا internal jugular vein. تمام. يعني eventually all of these together give us the internal jugular vein. دي الحاجة المهمة. The second thing that you need to know about them is that they're sitting في حتة الفينس في حتة الدورا folds ديل. تمام. يعني they're usually in the areas of the dural folds. They eventually reach an internal jugular vein. هم كتار, there are a lot. I'm only going to be highlighting the most important ones. تمام. يعني الفينس sinuses ديل ذاتهم they receive blood venous and then في النهاية بوصلوه للinternal jugular vein. Where do they receive blood from? They receive blood they're in areas of the dural folds. الfolds حقت الديورا of the dura mater. So like the dura mater ذاتها فيها folds صح؟ يبقى قلنا فيها tentorium و like falx cerebral cerebelli كده هم ذاتهم they're found in these areas. تمام؟ So yeah, they receive blood from a few areas. They receive blood من the cerebral veins, so من البرين ذاته. معي؟ So they receive blood from 3 areas. من the cerebral veins, so from the brain itself. From an emissary veins. Do you guys remember where the emissary veins are from? They're from the scalp, تمام? So they receive emissary veins from the scalp or the superficial veins of like the head and neck. So yeah. And they also get arachnoid veins, which are from the CSF. تمام؟ يعني they receive 3. They receive a cerebral veins من البرين, emissary veins from the scalp and the skull, and arachnoid veins, which are from they are CSF. تمام؟ الارachnoid تستغربهم كتير. ركزوا على cerebral emissary. تمام؟ So they receive blood from the cerebral, from the emissary veins. بيودوه وين؟ النهاية كلهم بيمشوا internal jugular vein. Okay? So eventually, the dural venous sinuses كلهم become the internal jugular vein. It's like the most important thing here, to know that they become the internal jugular vein. تمام؟ طيب يلا, here's the part that's confusing, and I don't want you guys to worry too much about it. بديك كده, don't worry too much about it. تمام؟ يلا, sinuses ذاتهم, there are a lot of them. There's like 1, 2, 3, a lot of them. تمام؟ And each one of them eventually drains into واحدة. So like دي بتخش في دي ودي بتخش في دي and so on. What I need you guys to know is a superior sagittal والcavernous sinus. الاثنين دول مهمين شديد. تمام؟ A superior sagittal sinus is the biggest, like it's really big, and it's on the border of a falx cerebri. تمام؟ So it's on falx cerebri. تمام؟ في تاني الcavernous sinus. Why it's important I'll explain in a bit. تمام؟ I'll mention the rest of the sinuses السريع, لكن don't bother too much with them. تمام؟ يعني عندنا a superior sagittal sinus, which is this big one. شايفين معاي؟ superior sagittal sinus قاعدة في superior border of falx cerebri. So it's on the superior border of falx cerebri. قاعدة شنو؟ superior sagittal sinus. superior sagittal sinus قاعدة هنا. طيب في تاني inferior sagittal sinus, which is on the inferior border of a falx cerebri. في تاني a great cerebral vein, which is just draining blood from the brain itself, from the inside of the brain. بعد ذاك a great cerebral vein with the inferior sagittal, they make something known as the straight sinus. تمام؟ Not too important. A straight sinus مع superior sagittal بيعملوا حاجة اسمها confluence of sinuses. The confluence of sinuses is like an area where all of the sinuses intersect or meet. So they meet together. Okay, let me repeat. So عندنا a superior sagittal والinferior. Inferior will meet with something known as the great cerebral vein. A great cerebral vein is collecting blood from the inside of the brain. تمام؟ So like من جوا, it takes out the great cerebral, meets the inferior sagittal, and so they form a straight sinus. Not that important. بعد ذاك straight sinus دي, it'll join to an area known as the confluence of sinuses. The confluence of sinuses هي area where most of the sinuses دي كلها بتلاقوا. So it's an area where they all meet. بعد ذاك from the confluence of sinuses, it goes بحاجة اسمها transverse sinus to meet a sigmoid sinus, and then the sigmoid turns into the internal jugular. So what's really important here is not الكلام ده كله. What's really important is the superior sagittal, the confluence of sinuses. بعد ذاك إنه الsigmoid becomes the internal jugular. تمام؟ يعني let's go back one. So what's important is in a superior sagittal, which is on the border of falx cerebri, وعندنا a sigmoid, which eventually continues as the superior bulb of the internal jugular vein. تمام؟ superior bulb of the internal jugular vein. في تاني cavernous sinus which drains برضو into the transverse، لكن we're gonna talk about it in a bit لسه. تمام؟ cavernous sinus دي في النهاية بتكون في الترانسفيرس، بتكون في السيجمويد، لكن احنا هنتكلم عنها على قدام، ما هنتكلم عنها هسه. It's basically found inside the brain برضو. Okay? Okay, let me go back and repeat time. طيب يعني عندنا superior sagittal و inferior sagittal. الانفيريور sagittal مع ال great cerebral veins from the inside of the brain بيعملوا straight sinus. والstraight بتكب في confluence of sinuses. Superior sagittal also drains into the confluence of sinuses. Then after the confluence of sinuses بنمشي by transverse، بنمشي as a transverse sinus. A transverse sinus meets superior and inferior petrosal from the cavernous sinus. Okay? It's a bit confusing, I know, لكن let's just write it here. تمام؟ في الcavernous sinus بتلاقي الترانسفيرس عشان يعمل لنا السيجمويد. And then the sigmoid becomes the internal jugular vein. So, يعني internal jugular vein is actually coming from the sigmoid, which used to be the transverse, which used to be the confluence of sinuses. And the confluence itself is receiving from the superior or inferior or great. رجعت لكم؟ Okay, that is great. طيب. This is another drawing of it again. Just again, don't bother too much with it. This is the cranial superior or inferior, transverse, sigmoid, internal jugular. And don't bother too much with the rest of them. بس المهمين تاني برضه confluence of sinuses because it's where they all meet up. تمام؟ طيب يلا نبي cavernous sinus, which I mentioned قبل شوية لكن I didn't say anything about it. Cavernous sinus it's found in the middle cranial fossa. So inside of the brain or inside of the skull. تمام؟ قاعدة وين؟ On each side of the sphenoid bone. So the sphenoid bone في النص, it's found on its right side and left side. في structures that pass through it, في structures that pass on its border. دي الحاجة المهمة. The thing you need to memorize is what passes through the cavernous sinus and what passes on the border of the cavernous sinus. تمام؟ دي الحاجات what you're really concerned with. So, structures passing through the cavernous sinus, the internal carotid artery, والabducent nerve. تمام؟ So it's internal carotid artery and cranial nerve, number 6, abducent nerve. Now, and structures that are passing on its border, so معها بشيلنا, are the oculomotor, trochlear, and trigeminal. So cranial nerves. 3, 4, 5. Huh? يعني passing through it is cranial nerve 6 and the internal carotid. Passing on its border are cranial nerves 3, 4, 5. تمام؟ طيب يلا. Keeping that in mind, let's take a better picture. This one's better. Okay, let's look at this picture. The cavernous sinus, تمام? The cavernous sinus is on this side and this side of the sphenoid bone, where the pituitary gland is. تمام؟ في النص internal carotid والabducent nerve. So these two structures that are found in the middle here are the internal carotid والabducent nerve. So nerve number 6. On the side of it or on the board are cranial nerve number 4, 3, and number 5. تمام؟ So دي حاجة مهمة شديد. Like I remember a lot of MCQs would be like, which of the following is a content of the cavernous sinus? Which of the following is in the border of the cavernous sinus? تمام. طيب يلا هنا كده. Okay. Fifth one is the trigeminal nerve. So trigeminal and oculomotor is 3, and trochlear is 4, trigeminal is 5, and 6 is the abducens, which is the one that's inside and not on the border. تمام. في تاني الدورة في spinal cord. يعني الدورة does not just stop in the brain. It continues to the spinal cord, and it continues. يعني the dura of the spinal cord is continuous with the dura of the brain. It's one dura, and it ends في a level of S2 in something that we call the phylum terminal. Okay, so just phylum terminal is the ending of the dura. It's at the level of S2. Cool. So the dura ends in phylum terminal at the level of S2. That's just يعني بس you have to just memorize it, I guess. Dura ends in phylum terminal at the level of S2. تمام. This is a picture of it. إنه phylum terminal continues up until S2 here and it stops. تمام. And yeah, يعني although the spinal cord itself ends في L1 L2, and dura mater continues all the way to S1 S2, all the way to S2. So far, is it clear يا جماعة everything? Okay, تمام. طيب عندنا arachnoid matter. يلا arachnoid matter is ما حقول فيه كلام كتير, mostly because it's not really an area of question جديد. الارachnoid matter قاعدة right below the subdural space. تمام. So the subdural space is above it. Below it طوالي في subarachnoid space. يعني الارachnoid matter is related to the subdural space above it, which is subarachnoid space below it. المهم هي subarachnoid space. But remember in the subarachnoid space, very important. ليه subarachnoid space is important? Because it has CSF or cerebrospinal fluid. تمام. So the area where the CSF, the part of dura, the part of the meninges that has the CSF is the subarachnoid space. تمام. فيها an area which stores CSF known as a subarachnoid cistern. ما مهم شديد. في arachnoid villi which a function حقهم is, wait a second, this was it. A function حقته is reabsorption of a CSF. يعني a CSF ده it's a cycle. It gets synthesized somewhere, it circulates, and it gets reabsorbed somewhere. تمام. فالarea where the CSF is reabsorbed هي الارachnoid villi. تمام. Yes, of course. طيب الاريا قلنا ال CSF بيبدأ في حتة. تمام. So it starts في حاجة اسمها الchoroid plexus. تمام. Don't worry too much about the details. Choroid plexus, where the CSF is formed. We form the CSF, and then the CSF will circulate. تمام. And one of the areas where the CSF will go is the subarachnoid space, which is the space that's right below the arachnoid matter. And then في النهاية, it'll be in the arachnoid villi. It will get reabsorbed into the venous drainage. تمام. يعني CSF بيبدأ الchoroid plexus ذاتها it's formed from arteries. يعني here في artery, So the blood basically goes from an artery to the choroid plexus to be turned into CSF. It'll circulate. Circulation حقه ما عليكم at the moment. And then after it circulate, it'll go to the subarachnoid space. And then من subarachnoid space, subarachnoid villi هترجعه للveins. قاعد لكم؟ Okay, تمام. So basically يعني the idea is in the subarachnoid space is where the CSF is going to circulate, and the arachnoid villi is area where the CSF is eventually going to get reabsorbed back into the venous drainage. تمام? That's all you need to know for the moment, because you guys, I don't think you did ما معكم الchapter حق CSF ذات نفسه. Right. So the subarachnoid space, oh yeah, it was written here, so I don't know why I said it من عندي. The subarachnoid space, when it has CSF in it, it's CSF that it's generated in the choroid plexus, which is found in a place called the ventricles. We'll talk about them later. It reaches برضه زي الدورة up until the S2, where it enters back the circulation to the arachnoid villi. تمام؟ So last thing we discussed was in the subarachnoid matter, or subarachnoid space, sorry. عندنا قلنا فيه CSF, and a CSF is generated in the choroid plexus, and it's found up to the level of S2, and then it enters back into the circulation through the arachnoid villi. تمام? Important thing to know is since the spinal cord ends at L1, ولكن السبارachnoid ends, but subarachnoid ends في S2. It means إنه you can use a space between L2 لحد S2 دي for lumbar punctures. تمام؟ يعني to take out CSF, you can use this area for lumbar puncture, because you know you're not going to be injuring the spinal cord. So usually a location حقت lumbar puncture is after the level of L1. تمام؟ What you do for lumbar puncture is that you're inserting a needle that's going to take out a CSF from the subarachnoid space. تمام؟ طيب في تاني البايا matter, which is the last one. It's the one that's closest to the brain, so it's closely connected to the brain. In the spinal cord, it forms a ligament. It's my denticulate ligament. It's just a ligament in the spinal cord that's there to stabilize it. Okay. It ends برضو at the same place في S2 at the phylum terminal. So in the three things البايا matter, that it's closely related to the brain, or closely connected to the brain. It forms the denticulate ligaments in the spinal cord, which is not that important. It ends at the phylum terminal. تمام? So S2. So all three meninges all end في the level of S2 at the phylum terminal. تمام? All good? عندكم أي مشكلة في meninges? Okay, great. Right. For the sake of the recording, يا كده احنا we're done with meninges. For the sake of the recording أنا حقفل الزوم وأفتح طوالي. تمام؟ Sorry for the inconvenience. عشان الريكوردينج حق السيربيلم يكون براو. تمام؟ الclinical correlations of the meninges يا هم as I already يعني اللي هو subarachnoid hemorrhage subdural hemorrhage و epidural hemorrhage أكتر اتنين. وتاني هو إنه ال CSF is taken from the lumbar puncture. ما في أكتر من كده يعني. Important clinical stuff. Okay, I'll just